actually going to bind us all together in this very nicely structured day-long program. We have an array of top-notch speakers who have created a history with their commitment to be successful. We have with us Dr. Debasish Bhattacharya. He has joined us yet? He's not joined us yet. Our eminent past president, Dr. Ashok Grover, another amazing individual, past president, and also a very much remembered chairman ARC who brought in a lot of positive changes during his time. Dr. Lalit Verma could join us too, our vice president who gave us a most awe-inspiring AIOS. Dr. Haripriya Arvind, who needs no introduction, who needs no instruction, who heads the cataract division of Arvind Eye Hospital, Chennai Group, and an amazing prolific surgeon of the country. Dr. Nirmal Frederick, a great leader himself, with a phenomenal understanding of NABH and the future status and the needs of the ophthalmic industry, and our ever dynamic Harshit, who's a member ARC Central, who's definitely going to be giving us a lot of inputs. He's also the chairman scientific committee of the Rajasthan State Ophthalmic Society. And as all of us know, he is taking life beyond ophthalmology to an entire different level. Maybe soon it will have membership more in that than we will have in AIOS itself. So let's start with our first session, Enhancing Clinical Practice. The first session will go on from 12 to 1:30. And our first speaker, there has been a minor change, is Dr. Shreyas Ramamurthy, who's a consultant cataract cornea and refractive of the Eye Foundation group of hospitals. And he's going to dwell on something so relevant to the younger population and so many of us older who need to move on in this direction. He's going to dwell on digital marketing is a must. On to you, Dr. Shreyas.
Thank you so much. At the outset, I'd like to thank all the organizers of the AIOS for such a wonderful conference, and to take such a large meeting virtual is indeed a major challenge, and I'm sure it's going to be a really successful one. The very fact that we are all meeting on a virtual platform, I think shows the importance and relevance of being digital and going digital. And while we are all doctors, ophthalmologists, it's important that we learn to reach out to our public, to our patients through the digital medium. Times have been constantly changing. In 2005, if you went for a particular concert like this, people were all looking forwards through their eyes. But take that away, which is a decade later, people are watching through their cell phones. Even though they are present live, the entire arena has completely changed. The way we consume news today, the way we consume information is all moved from a newspaper or radio or television towards the digital medium. And even in the digital medium, various platforms are now competing and taking over from one another. So in keeping with the trend of moving digital, the way the marketing spend has moved has also changed dramatically. This is a graph for the marketing spend of the United States. India is also on a very similar curve. And as you can see here, the traditional marketing is slowly dipping, but the digital marketing is on a steady rise and is likely to rise even further. And I'm sure in the post-COVID era, if you looked at these numbers, they are going to be significantly higher. It's not just that the way we are marketing, but even for the public or the patients who are reaching out, who are searching for suitable doctors or suitable hospitals, are also going online. The amount of keyword search volume is increasing every month, and a minimum of 200,000 plus patients are looking at relevant eye-related keywords like eye hospitals, LASIK surgery, best eye hospitals, treatment costs, etc., etc. And it's exceedingly important that we really take on digital platforms and digital marketing in all our spheres. Having explained the importance of digital marketing, let us go through some of these aspects, some of the key aspects one by one. First of all, to gain visibility, which is really what the digital medium gives you, we have two structured ways. One is called organic and the other inorganic. When we say organic, it is a kind of a slow, sustained growth, and it happens over a period of time. You're continuously working to gain organic growth. In inorganic media, which is very, very high in the digital setting itself, we do it through paid marketing. There are quick returns. You get a lot of leads, a lot of impressions. But then again, it may not have a long-term impact unless you slowly convert those leads into organic growth in a slow, sustained manner. So let us see how we go about doing all these one by one. So the first and foremost thing is that it starts with a very responsive website. And when I say responsive, the website, which previously we used to only think of computers and desktops, is now rapidly moving away from computers and desktops into smaller media, into tabs and into cell phones, and most importantly, into cell phones. So it's very important that you have a relevant website, which is, which can be changed from one media to the other, which has all the suitable tabs, the keywords. You have banners which are shifting constantly, ones which are live banners which are changing every few seconds. You have quick access keys like video consultations, online appointments, booking services, booking appointments, all of these which are quick access keys. You also have a live chatbot which is available in every page, which is very useful for any basic queries that the patient may have. It's also important to keep your website dynamic, that you keep including news and events which is happening in your institutes. You add patient experience, add testimonials, and keep your website live and fresh. This is just one data which I want to show at this point of time, where out of the 29,000 visitors to our website last month, 25,000 or 86% of them have accessed our website through a mobile phone. So it's extremely important that your website is designed to be friendly for viewing on a smaller screen, and it needs to be designed in that format so that even in the mobile, they get the same kind of user experience and user interface that they would get on a desktop. So moving on to the marketing itself, there are various avenues which are available today, and let's quickly take them up one by one. Google continues to remain the leader as far as the scope for digital marketing is concerned. And Google itself can be used through various means. It can be used through search engine optimization, which is organic. You have Google Ads, which is inorganic. You have AdWords and display ads. Then you have important Google reviews. And then you can analyze your entire performance of your website and your various activities through Google Analytics. So let me quickly take you through them one by one. So when we say search engine optimization, it's essentially ensuring that your website is coming forward in the rankings or in the web pages when someone is searching through relevant keywords. So I'm taking the simple example of Eye Hospital in Bangalore. Now we have a large presence in Tamil Nadu, and when we went to Bangalore, it's not easy that a person searching for Eye Hospital in Bangalore will get to access Eye Foundation immediately. But through consistent search engine optimization, through some consistent keyword optimization, you can actually see that we are right up there with the best hospitals in Bangalore. And this is possible through consistent work over a period of time. Before you go on to use the SEO itself, it's important that you analyze and do a kind of keyword search analysis. You want to see the sampling volume of searches for those particular keywords and ensure that you optimize for those keywords. Your website is optimized. Those keywords are added to various different paragraphs, different places, different backlinks are introduced into your website so that it ranks high when someone is searching for it. You also have inorganic Google Ads, which is extremely essential. You need to keep doing it everywhere, both in your established centers and your new centers, where essentially when somebody is searching for any keyword, it could be just an eye hospital in a particular place or your hospital itself. And this is an inorganic thing where the ad comes in. So here, this is a quick fix. You don't, when I say SEO, it happens over a slow period of time and you slowly move up the rankings from, let's say, the bottom two pages to the first page and to a higher ranking, the first page itself. But through these Google AdWords, you can actually ensure that your name is coming up first when somebody is searching for it. You can increase your bidding for these Google AdWords to ensure your name comes up first each time. Again, an extremely important aspect in ensuring that your ranking on websites on the Google searches improves is to make sure that you're publishing sufficient blogs, you're doing enough content writing. Quora is a very, very important platform where you submit various searches. So when someone searches for something like Best Eye Hospital for LASIK, your name comes up or your hospital name comes up, essentially because you've been consistently posting organic blogs and content writing over a period of time, answering different queries. And these serve as backlinks to ensure that your web page comes up. So these are just some screenshots of certain blogs that have been written in different places. It could be very general, very simple blogs to the public, addressing about facts of glaucoma, simple eye health tips, so many things which can be published in different blog sites. And these really ensure that they are backlinked to your website and improve the overall SEO ranking of your website. The next is really looking at your Google reviews. Now, Google reviews have really come into prominence these days. It's whether you're just going shopping or whether you're trying to buy a particular product or whether you're going to eat at a particular restaurant, all of us are looking at reviews. And it's important that you have sufficient number of reviews, you have a good ranking, good star rating. And it's important that you also start soliciting these reviews with your patients. Whenever you see a happy patient, gently telling them to provide a Google review is definitely very much accepted nowadays. Patients also look forward to it. They're happy that we are soliciting reviews, and they are very keen to give honest feedback. And these feedbacks, can range from naming your doctor, telling what nice surgery was done, how they like the facilities, or to our own surprise, where a person actually wrote about a cafeteria, something which we really never thought much about or never gave much importance to, but that was something which a patient highlighted. So various facets of your hospital gets highlighted through these Google reviews, and people do definitely look into them and consider it as an important factor in their decision-making while choosing the hospital of their needs. Google Analytics is extremely important, and in every month, we must go through these analytics, go through how our website is performing, how are various aspects of our Google ads and Google display ads and how they're working. So this is just a screenshot showing how many visitors came in, how many of them were new, how many of them returning, what page they spent more time in, what page they bounced off, which page they did not spend much time in. It also gives us a branch-wise overview, which branch received more clicks, where when we did a specific campaign in a particular area, how many clicks we received through those particular campaign. Then it also gives you how many calls were accessed through your Google ads. And it's important to have a dedicated number or a dedicated call center for these calls. We have a single number for all centers where all calls come in, and we're able to track these calls and follow up on these patients and ensure they are given the right information before coming to the hospital. Different campaigns which you might be conducting for different centers for different reasons, you really get a very clear idea of the amount which you've spent, how many clicks you received, what is the conversion rate, what is the total return on your investment. And this is the kind of analytical information which you'll get really very, very clearly only on the digital platform. Through your regular media, through your newspapers, it's very, very difficult to get such kind of very accurate information, but digital will give you a pinpoint information. Moving on from Google, we have Instagram and Facebook ads also, which are very much becoming prominent nowadays. And while Facebook initially was more an area where you were creating awareness, where you were just having an active Facebook page, you regularly put some posts, with some which will have interaction, some which will not have interaction, just to increase your number of followers, just to increase an awareness of your presence in that particular city. But nowadays, even in Facebook, there is a lot of ads which are coming up. And the benefit of a Facebook ad is really you can have a very highly targeted and defined audience. So you can define the geographic area specific down to the kilometer where you want the ads to be displayed. The language, especially in states where you have a vernacular language and you're trying to target a kind of the middle and lower middle class income group, where they are actually more comfortable in the vernacular language. And it's very important that the ads are also designed and use those vernacular pages. Age, income level, their interests, their education level, everything comes into play when we are trying to bracket the audience for our Facebook ad. So just an example of ads. So this is an ad, World Glaucoma Awareness Week. It's just an awareness ad which we put across all our centers in Facebook and Instagram. And through this, you can actually actively track our leads where you're offering a free eye screening for glaucoma awareness. Or it could be a very targeted ad for a young group, young audience in a particular town or city where you're trying to offer a particular service like a LASIK or refractive surgery. Is another center in Kerala where again the entire group is more comfortable in looking through a Malayalam page, and it's important that you are actually addressing them in their vernacular language and posting ads also in vernacular language. This was a particular campaign which is conducted during Ramzan, during the Eid period, and it had an excellent outcome even during the difficult times. YouTube is something which is really coming in. It's not as organized as of now as Facebook or Google, but it's fast catching on. And you have several YouTube ads, you have in-stream ads. Now, in-stream ads are something when people are accessing a popular net channel or popular network through on their YouTube channels, and these ads come in. And these are generally inorganic. Yes, you can continue doing them, but it's specifically useful when you're trying to launch in a particular town or city. Again, more important than these just inorganic ads is to actually go through educational videos, and you should promote these videos in an accurate manner. So having a patient information web YouTube page where you have different aspects, your regarding whether it's diabetic retinopathy, glaucoma, your different consultants are putting in videos, and these videos can slowly be promoted and gives them an effective overview and a good patient education, which increases the profile of your web page, your YouTube content, and your hospital itself. Now, after just doing these ads alone is not enough. The lead management also is extremely important. You get a variety of leads through various sources, and it's extremely important they are all funneled in the right direction. You have to bring them on to either your website or the particular landing page, or you have a call center where there are specific people responsible for attending to different campaigns. You have a dedicated mobile number for these campaigns to receive all these, and then they are all then converted into an Excel sheet, followed up, and you slowly provide these patients with appointments and ensure they come in. So it's just generating the leads is just the first step. The TAT has to be very, very good. Your response time has to be within 24 hours. You should respond to these candidates and ensure. Sorry,
okay,
there seems to be some disturbance.
Yeah, no, that's just a time's up thing.
I'm sorry, I'm done.
So speeden up.
Schedule. Yeah, I'll just finish in a minute. WhatsApp is another new medium which is catching on, and it's important you have your WhatsApp integrated with your hospital management software. This is just a screenshot where any kind of investigation report, any kind of discharge summary can be shared on WhatsApp to our patients. You can also have an active feedback system which can be shared through WhatsApp and analyze your NPS scores as well. Email marketing is slowly catching on, though we've not found it extremely useful. But at least when reaching out to a scientific group like our ophthalmologist group, it can be quite useful. So you have multiple avenues available, and with a gradual incremental approach, you can increase first your awareness about your particular brand, increase the awareness, build a brand, and then convert to patient leads altogether. Thank you so much for your kind attention.
Thank you very much, Shreyash, for your very great efforts at trying to convey something so very critical in the present day world in this cramped 15 minutes. But there was a clarity, at least a direction for us to know that, yes, we have to work actively towards that. So I'm going to ask the first question. I'm going to ask Dr. Nirmal Frederick. Shreyash, be with us till your question thing is over. What are your thoughts on digital marketing, Dr. Nirmal? In a city like Chennai, has it caught on effectively as it is in Bangalore and many bigger cities?
Yeah, thank you, Dr. Chitra. Thanks for the opportunity and very comprehensive talk, Dr. Shreyash. Yes, digital marketing is catching up in all the places, particularly where the penetration of software industry and IT industry is on really increasing. Right? Chennai had probably the third or fourth largest congregation of IT people, particularly in the suburban areas. And these are the people who really look into the digital ads, the reviews, or use all the search engines and social media, and then come to you. and most often these are the younger crowd. Okay, so we have to really target these people not only for bringing or seeing them, but also for getting their parents, who would be one of our target groups. And these are the people who are going to be the payers for their parents, and it's high time we concentrate on these youngsters who are technically savvy, and also they bring in the insurance people. So digital marketing is going to be the in thing in the next decade or so, and high time hospitals concentrate on this particular way of targeting or reaching out to patients.
Dr. Haripriya, are you there with us? Dr. Haripriya, somebody said she's there.
I'm here.
Yeah, she's there.
Haripriya, I wanted you to tell us, in your kind of a setup, does digital marketing have any role at all?
Yeah, so actually we are, it is good to listen to Shreyas's talk. So to see, as you said, the younger generation is better equipped and more aware of how to use this platform more effectively. And it is true that, most people do look up the different platforms when they choose an eye care provider. So I think it is extremely critical to be aware, to know of how your presence is felt out, and to have one team work on this exclusively. So while we may not spend a lot of time to do it in an inorganic way, I think organically you do have people who review you, you do have people put up stuff on you on Google and stuff. So it's good to be aware what the feedback is. And I think it's also good, like using platforms like WhatsApp or SMS, to be in touch with patients for their follow-up, for their feedback. So in other ways as well, it's good to use these platforms.
Shreyash, do you have anything to add on this further?
No, I think I've conveyed everything, but I just wanted to add that it's not just now in the bigger cities or towns, but the penetration is very, very high, even in smaller cities, smaller towns, tier 2, tier 3 towns. In fact, there are more people on Facebook from tier 3 towns and cities than even tier 1. The main reason is possibly the avenues for entertainment is a little lesser. And with the kind of penetration of 3G and 4G that we have, everyone is on their cell phone and everyone is on their Facebook. And there are various other platforms. Facebook is just one of them. And in fact, the younger population has moved away from Facebook. There is a generation younger than me who is no longer using Facebook. So, and they are actually, let's say, the refractive surgery population or other people. So I think it's extremely important that we are aware and use them in all cities, whether large or small.
I would ask Dr. Ashok Grover and Dr. Debashish to comment on this. We all know that advertising in print and electronic media is getting very expensive. So would you say that a digital marketing alone could suffice, or it is just one more anvil of support?
Chitra, I think Shreyash, first, congratulations for a wonderful talk.
Thank you, sir.
And I couldn't have learned more. And second thing, yes, I think this is the path forwards, and it's very futuristic because it's a two-way communication. It is very transparent. You can actually get the response, and you can understand the net effect of the campaign, as Shreyash pointed out. But what is more important is that the DMU, the decision-making unit of a particular procedure, if I have to undergo cataract surgery now, maybe my son decides or my daughter decides. So essentially, the DMUs are digital friendly, as also Haripriya was pointing out. And the third thing that we probably use in our hospital settings is we involve the staff to get a review from Google review, and we capture their WhatsApp number so that we can use them in campaigns, and that is also a review for the staff for their assessments. So we can mix a few things here and there.
Is Dr. Ashok there? Dr. Ashok is not there. Dr. Harshul, let me have your thoughts. You are the younger generation. Yes.
Yeah, thank you, ma'am. So Shreya's wonderful talk on digital marketing. We all know that change is the only constant thing in life. So we need to change with the changing times. It's very important. So I'd like to ask you that how much percentage of the revenue or your profit like you keep for digital marketing or any kind of marketing? This question is to Dr. Debasish sir also and to Shreyas also as a group. How do you decide that this percentage should go for marketing?
Frankly, I think we haven't evolved a specific percentage for each center. Of course, the newer centers, there obviously the spend is higher. At the time when you're doing a launch, the spend is higher, and at that time, that will be a very significant percentage of the revenue that center is generating. For established centers, it's mostly organic work which happens, and from time to time, small bursts, small campaigns which are conducted during different specific times like Glaucoma Awareness Week and here and there. We are not constantly doing at least social media ads for established centers. Of course, Google AdWords and other things is constant, happens right through the year for all centers. But the social media ads is a little fewer for established centers, more for the newer centers.
Thank you very
And
much.
what do you do of the?
Harshul, I think we should move to the next speaker.
Yes,
yes. That was amazing information.
Thank
you. Do stay with us if you can to contribute for the other
Thanks
talk.
to Ritika as well for teaching me most of the things which I've said in the talk. Thank you.
Okay, we'll hear from her too. Our second speaker is Dr. Vidya, who is a senior consultant, cataract and oculoplasty of our Eye Foundation group of hospitals from Coimbatore. And she is going to be talking on service delivery is my competitive advantage. And we also need to know that she's done her business management degree from the BITS Pilani, and I'm sure she's going to spout a lot of information. On to you, Dr. Vidya.
Thank you very much, madam. So,
can you share your screen?
Yes, madam, I'm doing it. A quick AV check. Am I audible? And
yes,
my screen is visible?
Yes.
Okay.
Yeah, can you start? We can't hear you. Vidya, we can't hear you.
Dr. Chitra madam and team A, I think service delivery can be an important competitive advantage for a healthcare organization. So as we know, we are all moving to...
No, signal is not good, Vidya. Harshul, can you hear her?
No, ma'am.
No, important, but it is quite in the sense the manufacturing.
Vidya, we can't hear you.
Okay.
Can you connect to your any other device in your room?
There is a network problem, I think so.
I think, Vidya, maybe if Ritika is there, you should come in as a third speaker. You get some of these people from LDP to help you now.
Yes, I have 1 second, madam. Let me.
We can hear you now.
We can hear you now.
Better.
You carry on
continue.
now. Yeah, continue.
Okay, now?
Yes. Yeah.
Okay, great. So I was telling you about the difference between the service organizations and the manufacturing organizations. Service organizations, our products are mainly services, which are mainly experiences. So the perception is very important, and that could change the entire concept and assessment of quality. That's the first point. Second thing is our products are all like heterogeneous. It has to be customized to each and every patient. It's not one size that fits all. And the third difference is that we have lots of consumer involvement in the whole process from starting to end. So that means, and also we have lots of moments of truth. So that means like if we have some problem that comes up to the mind of patient or to the eyes of patient, the entire concept of quality changes. So with that in mind, let's see how the healthcare industry provides quality. In the sense, like we always try to upgrade our technology. We try to provide the best operational facilities for our patients. We also upgrade ourselves to the pharmaceutical products and the optical section, and we provide the best in the market. And we try to have the best personnel with us to provide the quality service to our patients. So mainly, in short, we all focus on the supply side of the chain. And this is all we designed to provide the provisions according to the clinical guidelines. And this is what we think the quality that we are providing to our patients. But there seems to be a mismatch in the quality interpretation among the patients and the healthcare providers. In the sense, there is something called a technical quality and there is something called functional quality. Technical quality, we mean the technical aspects of our clinical diagnosis and the investigations that we provide. We are all tuned to do this. Every time we take efforts to improve our technical quality so that we provide the maximal quality possible to our patients. But unfortunately, this technical quality results and the efforts we take to improve the technical quality are all with us, the service care providers and the administrators. It's not being shared with the patients. And even if it is shared, patients are not going to understand the technical jargons. What they want is that the end result of technical quality and the functional quality. So the functional quality, we mean the process of getting the technical end result. That encloses the non-clinical aspect of the technical end result. Frequently, it's being neglected or ignored by the healthcare providers. We as healthcare clinicians, we are all taught to deal with the complexities of disease, but we are not taught in the interpersonal relations or communications with the patients, which we have to learn by experience. So there lies the whole problem. So patients' focus is on the functional quality, whereas we focus on the technical quality. So to put this information in a two-dimensional way, this is what we think we are providing to our patients. We provide quite a lot to the patients. So this is what we all provide. Whereas a patient comes to the hospital with an expectation, so which includes the clinical and the non-clinical expectations also. So this is what the patient wants. Look at the intersectional area. This is what the patient wanted and we also provided. The smaller this intersectional area, the more problem we have. Our aim is to improve this intersectional area to the maximum possible so that we stand out in the pack. So this is what we want to do. So in other way, like we need to have the input, also the output, and we also need to concentrate the whole process so that we provide a holistic or integrated service to our patients, which also gets assessed by the patients. So we know this functional quality is quite complex, but how do we unpack this complex functional quality? There is only one way out. We need to understand the perception of quality from the patient's point of view. And to say this in one definition, it is just the difference between the expected service and the perceived service. So we have to improve this part of it. We have to fill in this gap to improve our service. There are many models and methods that are being described. The most famous one is a gap model, which I've shown here, which is proposed by Parasuraman et al. And there are other models like AIOS models and validated questionnaires also. To give you more clarity, let me share some of the analysis that we have done at iFoundation, Coimbatore. This is based on ServQual questionnaire, which is a validated questionnaire. This has got two parts to that. One is an expectation part, the other one is a perception part. And it validates about 5 dimensions of service quality. The beautiful aspect of this questionnaire is that we could alter to suit our own local needs. So this was a tool that we've used to assess this. We got 320 responses, of which 294 were complete. The response rate was quite high, 89%. In this group, we had about 99 new patients and 195 review patients. So this group also had the demographic profile is given here. 57% of our sample size is above 46 years. And we had 49% of patients from the general ophthalmology and 51% from the specialty clinics. So we had a good mix of patients from representing all areas of the clinics. So basically this assess 5 important dimensions of the service quality. One is the tangibles, the responsiveness, reliability, and assurance and empathy. So what did we study and what did we get to know from this study is that we had quite a good number of positive perceptions. To say the few, people were impressed about the error-free documentation. They were also impressed with the accurate information about the treatment, the methodical way of examination, and the responsive staff members. we did have some kind of negative perceptions also. By negative perception, I mean where the expectation is high and the perception is less. Most important and statistically significant negative gap was found to be an undue delay in providing the treatment, meaning our waiting time was quite high. And it's good to know that we have exceeded expectation in all the aspects of assurance. And moving from there, what we did was that we studied the present state, that is otherwise called as the as a state. Like we visually mapped everything, the value stream mapping we did from the patient's entry point to the exit point, identified our areas of bottleneck areas, and that is where we concentrated. And we also identified our individual waiting area from different clinics. When we look at this, most of the areas, like except for this pre-cataract area, other than all the other areas were all sub 3 hours, which is like good. Still patients found this waiting time to be a little longer. And so we revisited our entire strategy. So from this exercise, what we got to know is that our operational strategy on waiting time, we revisited it, the process, the appointment strategy and the process of monitoring, everything we revisited. We also understood that we had quite a good number of positive aspects which added value to our patient care. We got to know about our negative areas and our areas of improvement, and we are working on it. So overall, I would say this kind of exercise could be an indication of our commitment towards service quality at all levels. So as I mentioned, the assessment of perceived quality, we can use feedback surveys, which can be done with a validated questionnaires, or we could involve some of the private vendors, or we could develop one for our own internal use. We have one for our IP billing, IP section. We can use a telephonic conversation, which can be done as a follow-up or follow-on activity. What is more important is we need to critically analyze this feedback surveys and patient satisfaction studies. It's not about the graphs, the movement of graphs ups and downs. It is more about the process and what all we can learn from that data. So that is what we need to concentrate here. So for that, we need to have a dedicated team which can look into the process critically from entry to exit at each point and analyze and suggest changes which can improve our practice. And the practice has to be a dynamic one. It's not a one-time process. It has to continue on. And there has to be a definite involvement of top management in the entire process so that quality becomes everybody's business. From chairman to doorman, everybody has to be involved in the process. So what should we concentrate actually? We should be concentrating on the hospital operations mainly, though the determinants are the tangibles and also the interpersonal communications. This is what we need to concentrate. Why should we concentrate? Because that is what is visibly seen by the patient and it's directly related to patient satisfaction. And it creates a positive word of mouth, which is an important form of advertisement. And it can be easily evaluated by the patient, unlike our technical quality, which we always do and nobody knows about it. Do we have any statistical backup to say that customer service is an important competitive advantage? Yes, that we do have statistical backup, but this is not directly from the healthcare industry. It's from different service industries. However, we can extrapolate these results to our own industry as well. So what we get to know is that 86% of customers, they say that they would want to pay more for a better customer experience. More important than this is 89% of customers, they've switched to a competitor after a bad experience. And 92% trust only the recommendations from friends and family over other forms of advertisement. And important to note is that 5% increase in your customer retention has shown to increase the revenues by about 95%. We definitely have to increase and improve our customer service to stay in the game. So we have talked about the importance of service delivery, but can it be a competitive advantage? We often use this term, but the competitive advantage, I mean that it is difficult for our competitors to imitate. How can we make our service delivery practice a competitive advantage? Only if we translate our organizational vision and mission to a sensible implementation program, which has to be unambiguous and it should have a clarity in the process. And we should also have the ability to learn and relearn from our own experience to improvise the delivery practice. So what I am trying to say is that we have to create value chain at each and every point of patient contact, from pre-service point of service and also the after service, and that has to be supported by the organizational culture, structure, and optimal use of our strategic resources from finance to technology. So everywhere we have to be creating value chain. So our shift has to be from mere supply chain to a value chain creation, so that it becomes a real competitive advantage. But there is one last thing to the whole thing, that is our own investment of time and energy in establishing the best service delivery practice. Unless we do this part of it, like in establishing the thing, the whole thing will not become a competitive advantage for us. So we have to do it. So stay on focus. Thank you very much for the wonderful opportunity.
Thanks, Vidya. You spoke very well and kept within your time, and definitely brought us all the more to think that it is so critical that we look at different ways of looking at the ophthalmic industry. And today, service providing being a great advantage and optimizing it is something so important. I'm going to be asking, is Dr. Haripriya or Dr. Ashok with us?
Yes.
Okay. I'm going to ask a question to Dr. Haripriya and Dr. Debashish in this session, and I would want Harshul to chip in too. Now, both of your centers, incidentally, are dealing with large numbers. So how are you able to manage quality and still keep moderate pricing and still have profit margins?
Yeah. Sir, do you want to go first?
Dr.
Sir,
Debashish?
you are muted. Yeah. Please unmute yourself.
Sorry. Yeah, the first thing is, unlike Aravind, we are a total paying hospital, so that takes care of we kind of shrug off our responsibility from the compassionate capitalism, and that keeps us more financially afloat. The second thing is about queue management, Chitra, you asked, and we have an appointment system, unlike Aravind. We have a minute-to-minute appointment system, and we spend 17 rupees per appointment. So that's quite a spend, and that helps a lot because mostly in this high turnover areas, you will see that patients are generally convenient moving around a particular hour of the day or a particular day or particular months. These are high months, these are low months, these are high days, low days, high hours, low hours. So this gradient is taken off, and then the queue management becomes more easier because there can be explained waits, there can be finite waits, there can be occupied waits. So essentially it becomes, and the intervention, if the waiting is less, I think like going to a spectacle or buying the medicines from the hospital or even going in for an intervention itself is facilitated. So these are a few touch points which I wanted from our experience. Yeah.
Very valid. Haripriya, you could even deal in a different way. How do you optimize your service providing in your massive setup? You must be having some kind of quality controls. How do you do that? We really look forward to listen to it.
So I think this talk by Vidya was excellent, and I agree with her that service quality is extremely critical. I think it's a very strong way of internal marketing. Even in the quality pyramid, one aspect which is there in the quality pyramid is patient-centric care. So once the patients come in, so we do have a lot of opportunity for us to get feedback from the patient, verbal, non-verbal, but also specifically, we do have questionnaires, we do have a focus group discussion with different staff groups. So, and whatever the feedback we receive, this could be through either a phone call or through SMS, and once whatever the feedback we receive, we try to share it with all the stakeholders, both good and bad. And also it's very important to share the positive feedback with the team. That I think actually encourages them to do better, and the negative feedback as well. So with this feedback, it also becomes useful for us to, enable change. If some patients are complaining about the food aspect, for example, repeatedly. So you have to go back and put your canteen area in place. So I think this feedback mechanism and this communication between the patient has to be more proactive. So the patients do take a lot of effort to come and tell us what they feel, but for us to take it up and follow it up becomes very important.
Thank you very much. Harshul?
Yes, ma'am. So I like Dr. Vidya's talk very much. And see, it is very important to be empathetic towards patient and give them a good perception. They should feel good, That's what we were taught when we attended LDP session in 2012. When I was in 8 to 10 years of my practice, I learned that they told us that the first impression of our patient is when, the door is open. So they should feel the warmth that time only, that yes, we have entered the right place. Then your reception is the place where they should get warm. So each and every step is crucial for your practice. And in a practice where, like in my practice, where only 1 or 2 consultants are there, we have a close practice. So patient always get a one-to-one attention, and all their queries are solved in one place. Of course, Debasish sir and Haripriya ma'am, they are in a big institute, so their practice is different. But of course, you need to take care of all their, the whatever they need, the patient, it should be fulfilled and they should feel good. You should be empathetic towards them. You should look into each and every small problems which they have.
I think I would go on to the third speaker, but I want Dr. Debashish, Dr. Haripriya and Nirmal even have some questions with them to bring up, because after Ritika, I think Partha might join right away or a little late, and we are together till 1:30.
I think Dr. Partha has joined.
He's already there.
Oh, he's already there.
He's there, yeah.
Okay, then Partha?
Yeah.
So you are ready for your next talk?
Yes, sure.
Okay. Okay. So thanks a lot, Vidya. You stay on with us because we would like to create some time for discussion of all the 4 topics, whatever extent it's possible. Yeah. Our next speaker is none other than our most dynamic, dramatic Chairman Scientific Committee, Dr. Partha Vishwas, who is going to be talking on something very serious and something very relevant. Internal quality control is the key. Let's learn some pearls of wisdom from him in the next few moments. And first and foremost, I think all of us, as the meetings have just started, congratulate Dr. Partha for a wonderful scientific content he's brought forward, and the number of people he has involved to participate as speakers or as moderators or panelists is just mind-blowing. Thanks a lot, Partha. On to you.
Thank you so much, Chitra. Thank you for pulling me up for this talk. And, while preparing this talk, I have learned so much about internal quality control and what are the things that I have not been doing, we have not been doing at our institution has really come to light. So it is very important that we have internal quality control, and it actually is the key. The areas of quality control, if we can just divide it out, and it is very important for us not only to go into the science of quality control, but more so in the art of quality control. Administration, I believe, is an art. Less of a science, more of an art. And again, quality control becomes more of an art than the science. So what can we break it down scientifically again here, but that is all that what science would say is quality of the treatment. So if we are giving good quality treatment, upgraded quality treatment, treatment that is at par with the best treatments of the region, of the state, and finally of the world today. So if we can charge the treatment offered, the treatment of service offered to this level and gradually upgrade it from one level to the other, there again is we have to give a comparison apple to apple to what we are doing in treatment, and everything today is there on the net for all our patients to see, all our patients to know, and each one of them knows that yes, this doctor is giving me this part of the treatment. If he is being served and treatment of cataract by SICS, he definitely knows there's something called laser technology and there's something called phaco technology, and he will ask for it. Because let us remember that our patients are different from what they were 20 years ago. So when they ask for it, we have to say that this is what we are doing, this is what we can, but this is what we cannot. So what we can and what we can't is, again, what we have to upgrade. The quality of service. The treatment is only one thing. Let us all remember, the quality of service is, again, that human part, that art part of the service that should be given. If the quality of service is not good, yet the treatment quality is world-class, that treatment transporting to the patient is not much for the patient. The patient's acceptance of that world-class treatment, if it is given shoddily, if it is given rudely, if it is not given with a smile, the patient does not feel happy, satisfied, even if it is first-class treatment that has been given out. And we know this from our day-to-day experiences over our patients day-to-day in our hospital. The next part is the infrastructure maintenance. If we can maintain good quality infrastructure, it's not just important to have a good phaco machine. The infrastructure, the maintenance of it, the paraphernalia, the disposables, and everything else, right from the OT to the OPD, handling the patient, everything is important for quality control. And where do we understand that are we giving what is required, what is desired, is by feedback. We have to have a proper feedback system right from the patient who is at the end point, next from our team, the staff in charge not only of the front desk, but also of the ward, the OT, and the different sections. The feedback has to come in, and then only we can say, yes, the treatment that I have been given needs appraisal, needs improvement, or are we in the right path? So the feedback is 100% important. And here a scientific feedback system is what is required. The skill upgradation, again, it's not just important to take a femtolaser machine and say that we have femto and blast it out into the media, that femto is there for you. No, we have to upgrade the skill not only of the surgeons, but also of the other team members, right from the OT to the OPD, as well as to the reception desk, where they have to say why is femto better and where femto is at par with the other different parts of the treatment. The quality of treatment for institutes and group practices definitely are different, but everyone, every institute should try and improve upon the quality. Similarly, group practices need to improve upon their quality to maintain high standard of patient care. Prescriptions go floating in the city. And this is one thing that induces into ourselves that my prescription should not be criticized. So we need to be understandable that the quality of the treatment is what we met out to the patient and what is given to the quality in the form of our prescription. Now, when we have a large number of patients, what happens is, yes, large number is there, affluence is there, money is coming in, patients are wanting appointment, and complacency sets in. And if mechanisms are not in place, if one is not in the toes, and if the expansion is not in view and not properly in view in the future, then complacency is something that definitely sets in. The routine internal and clinical meets and ideas of standardization, medical board for difficult diagnosis and management. This is something that we always have whenever it's an institute, whenever it's a group practice, and whenever it is important to have good quality consultations, cross consultations, and specialty wise. Even if a solo practitioner has to have cross consultation, it is important. Patients feel very, very happy that they have undergone a cross consultation by colleagues. The importance of cross consultation seeps into them, and it is good not only for the practitioner but also for the institution. Internal audit of files, and I am going to give here a small example of Shankar Nethralaya, where I'm an alumni, and there, and I'm sure in all the other institutes, the internal audit of file is a very, very important task. And when I was a fellow at Shankar Nethralaya, Dr. Mona Binde was assigned this responsibility by Dr. S.S. Badrinath sir, and even today, I think she's in charge of the internal audit of files. And every day, every consultant would receive a file or a statement that this file needed this amount of improvement, or this file was extremely well marked. And as fellows, we remember that whenever a file with a good comment used to come, it would make us so happy. So internal audit doesn't just mean criticism, but it also means appreciation. Adverse reporting mechanisms are important. Complication register needs to be maintained. And thereby, again, this is again a scientific part where the science comes in, where you maintain a complication register, where you do not forget that you've had this complication in the past twice a year, or 3 times a year, or 4 times a year. And this complication could have been improved upon. It could have been avoided, in fact. The appointment system, the identification of issues, usually appointment systems have to be very important. Reception, the quality of reception is very important. Waiting for area and the time is very important. Everyone needs a neat, clean, and especially in these COVID time, an area that is as much possible in these times maintained with the protocols that are required. The optometrist workup. He or she is the first person who is in the ophthalmological fraternity to interact with the patient. So it's the gate man who is the first one, who is in the receiving team. The receptionist actually is the second person in the receiving team. But when the workup is being done by the optometrist, he is the one, and the patient understands this guy is possibly a doctor, or he knows about my eyes, and he'll be able to. So a lot of questions are directed to the optometrist during the workup, and an intelligent optometrist will always prime that this patient needs this, and this patient possibly is a difficult patient to handle and should be handled extremely carefully. This patient is aggrieved. So in our system, usually the optometrist is a very important person who gives the cue how this patient has to be handled. Consultation by the doctor, and we all know with very good workups, very good diagnostic aids, the consultation becomes a small thing. But let us all remember that it is for those 3 minutes to 4 minutes to 5 minutes. And we need to give the patient that huge amount of importance so that he or she has come a long way, waited maybe a week or two, has gone under so many other parts of the full workup system, has waited for 2 to 3 hours, and thereby has come to that door where he or she has sought that appointment for that particular doctor. Diagnostics is very important, and thereby complete only by the diagnostic aids. The ward experience, the surgical experience, and the housekeeping experience, everything is important. Not so clean washroom is something that a patient will always remember. If someone has held the patient's hand when he or she was assisted onto the OT table, that experience they will never forget. And if in the ward there was a touch with a feeling, that is an experience that these patients never forget. The common complaints, of course, we know that no one answering the phone, appointments not available, phone is always busy, and these are feedbacks that we constantly get. But the solutions are also there, and we need to look into the solution for our setup, for our specific requirement of the service that we are giving. First impression is always the key at the reception, and waiting time, rude behavior, handling, demanding patients. The reception will say, oh, what a rude patient. Gave me a hell of a lot of difficulty in doing, I did my best. But the reception person possibly forgot to smile and say, sorry, ma'am, you have to wait. I'm very sorry. Let me help you. So this is something that they would have really appeased the patient and got them. So solutions are small, and we need mock sessions, the staff selection, and the personality of the staff is so very important. The problems of overcrowded waiting area, long waiting time, and of course the solutions are there. Floor managers, in and out time, constant stress by top management. The identifying the interiors. Again, if the air conditioning, etc., is not in proper use, you have to have maintenance managers, complaint mechanism from all areas, and the OT equipment and instruments have to be all the time be upgraded. So active feedback mechanism puts you back on the track whenever complacency sets in, and I definitely do believe genuine problems get identified from the end user. Positive feedbacks help in getting all-round view of the facility. At BBI Foundation, where I work, we have a small system. Whenever a patient says, oh, doctor, we have had such a nice experience. Oh, you are so good. And this one helped me so well. So everybody at BBI Foundation that day gets an eclair or a small Cadbury, just to remind that your work, the whole team's work has satisfied this particular patient. So skill upgradation is important to improve the quality, hands-on training, having good academic environment for fellows and interns, and there are so many other ways for quality control in the net and in the literature. It is an ongoing process, cannot stop. Few key staff need to be identified for the internal control of monitoring, process-driven system rather than individual-based. And as an institution grows, it has to be a process-driven system. And you cannot rely on that particular individual who's going around and acting as the manager of giving solving the important problems to giving the solution. Good patient flow doesn't mean it's good quality. So let us all the time avoid complacency. Don't think that the patients are going to be there forever. No. If that complacency sets in, patients at one point of time will go away. So let's develop good feedback systems. Let's be receptive to criticism, as the saying goes. Nindak nihare pa rakhiye angan kuti chhawaye. Thank you very much for your patient hearing.
Very nice, Partha sir. And your timing was dead perfect, no? Bang at 15 minutes, you stopped your talk. Amazing perfection. And so we can imagine how perfect you have placed your systems for quality control in your hospital. So, so tell us something about how small practices can also keep quality control. Like it's not possible for them. So what would you advise?
Yeah, in a very small way, I think, I was a very, very small practitioner at one point of time before we had a group practice environment. So all the time, whenever there was a criticism, I immediately took it up and I asked myself, this guy is criticizing, I have done wrong. There is something wrong that I have done. So at times it was really very maddening and it was very upsetting after everything I have done for this patient, and this patient says that, doctor, this is what has happened. And one puts it off. But if one can take that criticism, said, if this guy is criticizing, I must have done something wrong. I will go back as a practitioner and think that, no, my reception person didn't behave with him properly. He came very upset into my chamber, and obviously everything got haywire, though it was a very simple problem, maybe of a tearing or whatever. So even a small practitioner, whoever starts small, has to be cognizant of the fact that feedback, and as the practice grows, it has to be more scientifically assigned to other people who are taking feedbacks, providing the solution. Because for a practitioner who is going from small to big, it is a very difficult position. Big means more number of patients, so overflow of patients, more number of complaints. But those have to be solved as much accurately as possible. And when it comes to be institution, then it is a little more of a comfort zone, because for 10 practitioners, if you have good quality control systems in place, it works very well. Everybody accepts it. Yes. So that is how the growth is. It is more difficult, I would feel, for the smaller practitioner who is just starting to the larger clinics. And that transition is a very important transition for quality control.
Yeah. Dr. Nirmal?
Yes, Ashul.
Yeah.
Yeah. Thanks, Ashul. And thank you, Dr. Partha. It was a wonderful talk. Hearing from a scientific committee person, the quality management issues and the strategies. It was a very compiled and concise presentation. Thank you so much. And Ashul, to answer your question for small hospitals, if you heard the last three topics on the quality control by Dr. Partha and the patient satisfaction by the previous speaker, and then internal marketing and the various strategic marketing. And I would really advise you to go through the NABH standards, the entry-level standards. So most of the important points talked here are all part of NABH standards. Don't go for, that's what I would advise the small practitioners. Don't go for accreditation, but use the standards to your benefit, right? Read the standards, see how you can implement some of them in your day-to-day practice. So that gives you the entire information and knowledge for single practitioner or small-time practitioners, and how to go about setting the right infrastructure, how to set up systems and processes, and what outcomes you can follow, and what all internal audit or quality indicators you can devise for your patients. So all this you can work up with the use of standards. So then you can implement some of them, see the benefit, see how you reap up the benefits and how the indicators are changing for your practice. And then you can go on to go for entry level or main standards. So that would be easy for a small practitioners to understand the management aspect, because most of us come from a clinical background and may not understand this management issues. So the right way to go is step by step from entry level to the main standards.
Right. Thank you very much, Partha sir. So I think let's move on to the next speaker, Dr. Ritika Sachdev.
Before that, can I excuse myself a little bit and take leave of all the stalwarts here? I'm really so happy to see Debasish sir.
You'll be very, very busy these days.
Yeah, we know.
Yeah. So if I can excuse myself, please. Ritika, very sorry I couldn't listen to your talk.
Thank you, sir. But God, you put up a great show, and thank you from all our sides.
Thank you. Thank you.
Should I share my screen?
Yeah, please share your screen.
So I actually was fortunate to be given this topic 3 months ago. But when I was reviewing the presentation, I realized this is not what I want to talk about. So this presentation is really 2 parts to it. The first is me thinking as a clinician, and the second is me thinking. So let me just take you over the presentation bit by bit. We've talked about various things that we want to achieve. In order to achieve anything, you have to measure it. And measuring something requires data. Now, this is a slide I use very often: talent, trust, and technology. The reason we use technology here is not just for the femtosecond laser, but for technology that allows data to be actually not used as an experience of an individual, but as a system that guides you. I think a fundamental thing that I've noticed about medicine is that it lasts a lifetime. And therefore, it's an industry that possibly hasn't risen as much as it could, because you have to relearn the lifetime every time a new doctor comes in. And therefore, having a system like Google, of course, that's the next level, but that is where technology comes in. And therefore, data, instead of data points, has to be a system and an ecosystem. So this is me thinking as a clinician. We use clinical data, operational data, and data to guide our marketing and sales team. Of course, we also use financial data. Financial data is a large subset, so I'll keep it out of the context of this talk. When we use clinical data, we are fortunate that most of us have moved to the EMR, and we are capturing all the relevant patient details in terms of history, be it ophthalmic or medical. We have a great amount of demographic data, where our patients come from, what are their allergies, what are their comorbidities, etc. So what do we use this data for? We use this data to give us confidence that we know about the medical history of this patient. The patient also has the confidence that if I go to this institution, they have my entire treatment chart and diagnosis available with them. It helps us optimize the patient experience. For example, if the data shows that this patient is undergoing treatment for glaucoma, he may just get a pressure check, he's not going to get dilated, we'll go to the glaucoma wing. So you've really optimized the patient journey and overall led to a more efficient way of functioning. You also have statutory requirements for keeping data, and data helps us in research. When you are running an organization or even an individual practice, there are indicators that you must assess for how productively you're using your assets, because an organization has assets in terms of the infrastructure. And in order to get maximum productivity, you have to utilize them most effectively, not only in terms of the number of visits, but how you spread the visits. So we routinely do certain parameters like OPD hourly analysis to see how it's clustered. Irrespective of how much you try to tell patients, don't try to come in the morning, come in the afternoon, it wasn't working. So what we started doing was asking our post-operative patients to come in the afternoon, or actually at certain centers where the morning rush was getting too much in the times of COVID, we slashed our OPD fee by half to incentivize them to come in the afternoon. Patient registration is an important touch point, and there are various metrics that you may have here, one of which we use is the patient registration TAT, that it should not take too long for the patient to register, the journey time through the dilatation and the undilated journey, the optometrist workup time, the optometric productivity, and the consultant productivity can be assessed. Now, do notice that we can do this manually with registers, but that would make it very difficult. If you have an EMR, you're capturing all this. The time the entry started at the front office to the time the first receipt was generated, the time that the optometrist logged in and logged out for this patient. So all these data points are actively going to be generated without you making any entries. And that is what makes data a system. We also have to look at the profitability of the organization. So assess the OPD volumes, also assess what is the proportion of new OPD, because new OPD basically means you're increasing your market share and you're not losing out on the new patients who can get funneled into the system. Look at the IPD conversion. Look at how many patients are being advised surgery. So normal healthy practices may have a proportion of 10%, surgical referral centers 20%. If your percentage of surgical advice is less than 5%, you need to work and see why are patients not coming to you for surgeries. Look at OPD procedures and the conversion. Look at the procedure ATV, or the average transaction value, to see if you can upgrade certain patients, or is price a concern, because you have to know how price is being perceived by the patient. Look at the cash and credit mix to see where you can focus on. Look at the service mix. What is retina contributing to your practice? What is glaucoma contributing? What is opticals contributing to your practice? What is pharmacy contributing to your practice? So that you know that this is in line with what the industry standards are. There are industry standards of 10 to 30% of opticals contributing to the revenue, 30 to 70% contribution from cataract. You have on an average 20 to 40% contribution from super specialty surgeries if you have them, and you have about a 6 to 10% mix from the pharmacy. Of course, OPD also is a significant portion of revenue, particularly for the solo practitioner. Now, one thing that I think is the differentiator, and Vidya really spoke about it very well, is that healthcare is seen from the eyes of a doctor. But we are now entering healthcare 4.0, where it will be seen from the eyes of the consumer. And the consumer, we call it the patient, but the consumer experience is what will determine how the brand is perceived. And therefore, you have to have metrics to really evaluate the consumer experience. We do an NPS score for all our centers. An NPS score is basically your promoters minus the detractors. So that if you have 100 people, these are the number of people who say they are willing to promote your service and they're so happy with it. You may have people who are neutral, they won't count. And then you have detractors. So promoters minus detractors is your NPS. And the NPS should ideally be in the upward 60s or about 70 for a service industry. So we benchmark this NPS and we make a dashboard of all our centers, the leaders and the laggards. We also note that whenever you have a detractor, you have to do a service recovery. So you cannot manually be doing service recovery. I'm at the risk of trying to stick my neck out. An individual may do service recovery at an institute, which he or she is heading. But you need, if you are spreading yourself bigger, there has to be a system that comes in place. You cannot solve service recovery by the doctor speaking to the patient. It has to be a dashboard that throws up that this patient is unsatisfied. There has to be a complaint resolution and there has to be a TAT to it. You have to resolve the service recovery within 24 to 48 hours. When you're doing an NPS, you also need to have an NPS, which is department-wise. Your front office has an NPS rating of this, your optical, your pharmacy, so you know where to improve. You also have Google reviews that you can track, which is actually now the new word of mouth. So we have a Google review, the number of Google reviews and the rating that we track across the centers. Data is also used for giving marketing information that this is where your patients are coming from. This is the ROI on the marketing inputs. So if you don't capture the source of patient, you don't know what has led this patient to your center, and you don't know what geographies they are coming. Like I said, we continue to track OPD volumes, the new OPD and OPD greater than 50 years of age. Data definitely speaks, but can it speak to us in the form of registers and Excels? Possibly not. I've given you this snapshot in 5 seconds. It doesn't speak to you. But when I put it in a dashboard and you get a trend, data to create patterns to build conclusions is where we need to go to. So this really means that we should spend an effort, and it's not very difficult to create dashboards. So this is, again, something that we are all routinely doing and has been mentioned by various speakers in these talks. All I'm trying to say is let's create a system out of it. Let it not be the experience of an individual or a team. Let it be scientifically created dashboards, which actually are now experience is nothing but information that you're processing. And with the computational methods that you have today, a system can actually give you a lot of experience. So that is something that we should continue to do like we are doing, but take it to the next level. How to take it to the next level is something that actually came into my mind when we had our branding person hired for the first time from a non-healthcare background. He had worked in Samsung and various consumer facing industries. And he said, how do you market? Who are your patients? I said, they come from there. We need 50-year-old plus, we need cataract patients, this geography. He said, do you have your consumer profile? I said, what do you mean? He said, marketing without data is driving with your eyes closed. He showed me this quote. I said, this is okay, but what data do you need? So he said, how many patients do you see in a year? I said, lakhs of them, 6-7 lakhs a year. He said, how many years have you been functional for? I said, 25 years. He said, you will in a short course of time have data for 1 crore individuals. So you're dealing with big data. Big data is a term that has been used very often. Now, what is big data? Big data is data which is huge in volume, huge in variety, and huge in velocity. So you have a lot of data flowing in volume, in different contexts. And this data is so huge that an individual cannot draw inferences out of it that a system can. So this data is something that is a gold mine that a lot of ophthalmologists and healthcare practitioners are sitting on, but not using. So what I told him, listen, we use our data, we send appointment alerts, we send reminders, we sometimes send promotional offers to our database. We have their demographic data. We know if they have given a good feedback or bad feedback. His response was, you need a complete consumer profile. There are various CRM systems. I actually noted that Max and Fortis and multi-specialities did try to bring up CRM, but no healthcare today has CRM as good as even a Practo or a Lenskart. So this is what a CRM does. It gives you a consumer profile. The good thing about healthcare is we have easy access to information. If you ask a patient for his phone number, he will give it. Unlike if other people ask for it, I won't be willing to pass on my phone number. Once you have the phone number and the email ID, the internet has created an integrated persona for this person. When you note, when you're going to a site, they say log in through your Facebook account. Why? Because that integrates the profile. Through Facebook, they know your interests. Through your interests, they know your peers, they know your friends, they know your ecosystem. So we have access to data, but we haven't integrated it in a way that big data can allow us to do. So there are various tools available. In fact, reality check is I was reviewing a lot of EMRs because we wanted to go. No EMR today looks at CRM. So that is a reality check that we are looking, we have big data, but we are not using big data. So when I took a demo of the CRM, my marketing person tells me that, listen, at your website, you had this smile page, 6 people visited your page, out of which 3 of them are already your patients. So these 3 patients are actually coming to your hospital and they're interested in smile. I don't need an optometrist to tell me that. Their phone number tells me that, right? If somebody has written nasty reviews on Google, and he is coming to your center through a phone number, you know this person is hard to please. The optometrist doesn't have to point it out. There is a red flag that you already know. If somebody has come to you and he's a friend of somebody's ecosystem who has got a femtocataract, this possibly is a patient who's willing to upgrade. So you have so much information about people just by looking at their integrated profile. I actually looked at the Lenskart website because, just wanted to see the trends. Am I audible?
Yes, you are audible.
So I put a filter of rose gold and I was checking cat eye glasses. So the Lenskart communication that came to me was not generic. The ad that showed up has a rose gold cat eye sunglass. So they have used information that I have given them in order to make their advertising more relevant. And though anybody can go on Google and social media and put up ads, you need to put up ads, not what you want to say, but what I need. And as a Lenskart consumer, he's shown me what I need. I'm more likely to click on it. Lenskart will get a customer acquisition cost, which is lower. They will get ads which deliver a higher return. And this is just simple data. They've just captured the filters I put in when I went to their website. So this really now is a transition of me not thinking as a clinician, but thinking of possibilities. So we are sitting on big data, but we're not thinking big. The Harvard Business Review of the United States states that digital advancement by a sector in the US, which is ahead of us in digitization, healthcare is the bottom. You have agriculture and construction to compete with. So just look at an industry which has so much data. Look at the digitization that we have done. And this is what a software engineer actually had to say about healthcare professionals. He said, what do doctors use data for? They use it for billing and history. But you are in the information business and you are not designed to learn from the whole patient base. You are looking at a patient, one patient at a time. You are looking at patient through the lifespan of one doctor. And he says, doctors have no appetite for big data because whenever I speak to a doctor, they say it's garbage in, garbage out. My front office has made a wrong entry. There's too much noise in this data. That's because doctors deal with small scale data and this needs to be randomized and multiple things done to it. So it's statistically significant. But the beauty about big data is that the data learns from itself. So with big data, it's not garbage in, garbage out. It's garbage in, fertilizer out. Because large data can learn from itself. It can tolerate errors and develop intuition because the data points talk to each other. And that combines to create a profile. So he said, this is what healthcare professionals do. You create a library catalog. So every patient is a different file. But any input that one patient has given you will not help you care better for the next patient. Our EMR is just an electronic version of this library catalog. We have not upgraded to Google. Google has so many searches, but do you know how beautiful it looks with it? When I'm typing, Google knows what I'm searching for. I think all of us have felt that. Google knows us. How have they gotten this information? Through users. We have so many users of our system. Users are not just people who use the library catalog. They are people who give you information to improve your system. We are trying to improve the system by our analysis simply, but the user will give you enough pattern to tell you not only the problem, but part of the solution. So let's just look at possibilities. When you have EMR, now you know, even if you type a mail, it has a predictive possibility. So will EMRs have. I think some EMRs have already come to that place where when you simply type CAT, it will put up the whole dashboard of cataract, investigations, lab tests, which will save you time. Also, it will develop patterns and help you with research. But for that, I don't know when it will happen, because doctors sometimes work in silos. When we all come together and create a platform, which is larger than any platform even a practo can create, we will be able to expedite research and really develop phenomenal things, but possibly too futuristic. It also helps you do away with errors.
You'll have to conclude faster.
Just 2 minutes, sorry. Because, for example, if I've written timolol and the history says asthma, you can auto-populate that this is contraindicated. Also, I think the beauty that I'm really excited about is customer profile. All of you must have been on Netflix. Now, if I look at romantic movies, the Netflix poster for Good Will Hunting looks like this to me. It is the same movie, but for my husband who's looking at these kind of movies, the same poster looks at this. The same product is packaged differently to appeal to different customers and what they need. There is a customer profiling even in the call center where they can, from the way the customer says, for example, he has used the word, I will cancel my appointment multiple times. You know, he's going to create chaos, and automatically that customer profile will, next time he calls, go to a person who's the senior most in your call center who knows how to handle it. So there are various things that are being done presently. And this is the future. Yes, we talk about teleconsultant, a lot of things not being effective because we don't have data, but we are living in the Internet of Things. If you speak to AI companies in 5 years, fundus photo, visual acuity, and refraction will be done from a smartphone. We have devices which automatically tell you how much the IOP is up to 80 times a day. Arvind is also working on one. And this can be done through a Bluetooth and just transmitted to the doctor without needing to walk into the chamber. You have electronic IOLs which can auto accommodate and actually with a blink take a photograph. So the Internet of Things is actually just 5 years away. So data is going to be available longitudinally. It is for us to decide that when data is talking, are we willing to listen? Thank you.
That was a mind-blowing talk, Ritika. Nothing would have been expected less. When I entered your name, I knew how it's going to be. Do we have Dr. Haripriya and Dr. Debashish? Just one question. After what Ritika says, we have a very, I've been going into what she's done a great job, but something very simple for the young audience here. If we have a good, sturdy, old EMR, which is able to provide us all the information, do you upgrade it and go in for the latest EMR facility, or do you stay as we are? Would you think differently if you have a smaller center, 1 center, 2 center? Would you think differently if you have a larger number of centers? I would want Dr. Debashish to comment and then with Ritika to add something.
Well, Chitra, it was an amazing talk. Ritika, congratulations. I would go by her second pointers, where she says about artificial intelligence, the CRMs. I think, Aravind, all our practices, we can really pull in a lot of data together, and our own individual data can mean so much to us. Yes, the EMRs that we have, how we use it is the intervention ratios of the compliance at every level, whether the appointment was complied, whether the optometrist was converted into spectacles, surgical advice, laser advice, etc., etc. So there is a pattern. You have these figures to talk to consultants, which makes the conversation more easier, and also motivates and stimulates things. So yeah, I think we're over.
Dr. Haripriya?
I think the time is up, but I think a wonderful talk, Dr. Ritika, and I completely agree with all the points suggested. The EMR is a wonderful point, but I think it's also how do we gather information from the EMR to improve the care for that specific patient, and overall, how do we pull this information forward so we analyze it in a big data format also will be useful for our patients in future. Thank you.
Anything concluding, Harshul?
Yeah, very nice talk, Dr. Ritika. She rightly said we all have our data in our EMR. We have a lot of mobile number, email, but we don't use them. They are not working for us. So I hope Ritika very soon will come up with something which you can utilize to integrate that data which can be useful.
Anything
Looking
to
forward.
add? Final comment, Ritika, you have anything to tell us? Or we have a long way to go to reach you, I guess.
No, I think I just feel that doctors work the hardest, but work in silos, and somehow something big has come forward as Arvind and Dr. Debashish. But there is just so much potential. Just common platforms to at least work on data and many other things will just make this industry go to a place it deserves.
Yes. Thank you very much. This could go on and on. Thank you very much, dear speakers. Thank you very much. The best of expert panel who I had with a real great experience about patient care and data management. I would be so happy if you stay on with us a little more and take part in the further sessions if possible. Thank you, one and all.